Hello again, and Happy New Year once again. So it's Friday, the 27th of this great year of 2023, and I had posted my first video last week, I think, or a few days ago, and I asked if anybody had any questions, and yes, I'm very grateful that one person did reach out and ask me a question. So I'm going to take this video, might take two videos, short videos, to respond. And the question was basically, how do I get started with my patients in terms of the program that I offer? When does the hands-on or the physical part begin? And so I answered in the comment, but I'll elaborate a bit further here. So the first session of my program is always a talk intake, which is like what all therapists do, and that's a meet and greet and make that first connection, life to life, in person, and in my home office. So we sit and talk and get a sense of each other, and an opportunity to ask me more questions, of course in person. We had talked already, of course, on the phone before deciding to work together, and then I gauge it instinctually, but like roughly halfway or 40 minutes in, I may start to I do shift the conversation to asking for a little bit more of a background of that person, just their personal history, and this is something that pretty much all therapists do as well, just to get an understanding of how the patient perceives themselves and their past, and just the basics, where they grew up, and their experiences. I gear it more towards, their early beginnings, how their relationships with their family and the culture and how they've been affected, particularly around how they've been affected by or indoctrinated or absorbed the messages around sexuality, and when they remember coming into their bodies, when they began feeling sensations, when they began masturbating, when they began noticing attraction to others, and then kind of the headlines of their romantic, intimate experiences, or lack of, and what they, how they perceive their life experiences as it relates, right, to why they've come to see me, which has to do with some kind of intimacy issue or functioning issue, challenge. So really, I'm just getting that background, so I can really gauge or asking for that background, so I can get a sense of how the person in front of me has gotten to where they are, what led them, and gives me more insight into some of the factors that have really maybe contributed to their dis-ease, and the value of this is often it's the first time, almost always, that a person has shared in such detail about these kinds of really private, intimate, sometimes shameful feeling, embarrassing, sometimes even more like distressing for them, and it can be very cathartic to be able to release all of that and trust and let someone else know. It can also bring up a lot of feelings around being vulnerable and having just shared all of this and with another human being. And this is even true of people who have long histories of being in therapy. Many have shared that they've never broached these subjects with their therapist, even their sex therapist, or they haven't gone into detail, or the therapist hasn't asked, or the therapist minimizes some aspect of what they're sharing in terms of it not being, they feel it's not that important to their therapy. So often I hear this. So really, it's their place to just let go and let out. So this is so important for us to establish this initial rapport and trust, and energetically be in the same room and sense each other and feel and know that it's going to be okay. So yeah, this is the first part, and then I'm going to follow up this very next video with what then happens. So this is talk only, yes. This first session is always talk only. That said, actually, I'm going to wait to the next video and then add on another piece to what happens during the first session, and then move a little bit into the second session. And these two always have the same components in them, adapted, of course, to the person I'm speaking with. Anyway, okay, thank you. Thanks for listening.